In June of 2000, I made a decision that would change my life forever when I joined the Peace Corps. I was seeking an adventure, but what I found was much more, for I discovered that sometimes pain and suffering can become our greatest asset, transforming our lives beyond our expectations and ultimately giving us a higher sense of purpose. My story begins in Burkina Faso, a landlocked country in West Africa, ranked as one of the poorest nations in the world. I was assigned as a community health volunteer to Lokoso, a remote village in Burkina's southern region. The Peace Corps philosophy of cultural integration dictates that volunteers live at a level similar to the community in which they serve. So I lived in a mud hut with a grass roof, no running water, and no electricity. Cell phones were not yet commonplace. The nearest city with a reliable landline was over 30 miles away. At the time that I lived there, Lokoso had a population of 800 people belonging to over 4 ethnic groups and speaking more than 6 languages. Islam, Christianity, and traditional African religions were all practiced. Yet despite this diversity, the people of Lokoso had one thing in common. They were all incredibly welcoming of outsiders. Though I was the only foreigner living in my village, I was always made to feel like a family member. The chief of my village treated me as a beloved daughter. And though he has since passed away, I still consider him as my African dad. My role as a community health volunteer primarily consisted of managing, organizing, and supporting health promotion and disease prevention programs. In collaboration with community leaders and village volunteers, I coordinated health education activities to combat guinea worm, malaria, malnutrition, diarrheal diseases, and HIV, including directing a theater troupe which performed educational skits on market days. I also assisted the medical team at our clinic with the logistical aspects of vaccination campaigns and a grant application to improve the infrastructure of the clinic. The Clinic of Lokoso served a population of 5,000 people spread across 15 surrounding villages, some as far away as 22 miles, and accessible only during the 6-month-long dry season by foot or bicycle. 1 medical assistant, 1 midwife, and 1 pharmacy technician comprised the medical team. You'll notice that I did not say doctor, because in most of the developing world, the severe shortage of healthcare workers means that people living in rural areas may never see a doctor in their lifetime. The majority of medical care is provided by clinical staff with less than 2 years of medical training. Further complicating this issue, given limited financial resources, patients often present to health facilities very late, when their condition has progressed to a point where death is almost certain. Understaffing is also a barrier to healthcare service delivery. When our medical team had responsibilities which took them away from the clinic, our janitor assisted with patient care, obtaining and documenting medical histories, and sometimes performing emergency medical procedures. When confronted with the decision to try to do something to help or do nothing and let someone die, our janitor chose to act. Like the janitor, I had no formal medical training, but I sometimes assisted in the labor ward and once even helped an injured man on the side of the road who'd been involved in an accident. I loved life in my village. But everything would change one day, 16 months into my service. As a Peace Corps volunteer, you are provided with a bicycle as your primary mode of transportation. When traveling far distances, you take public minibuses. So when a Peace Corps Land Cruiser appeared in my village at the end of September 2001, I was immediately concerned, for it generally signaled the delivery of bad news. The driver handed me a note from the Peace Corps medical officer asking me to travel with the driver to a telephone and give her a call. As we drove 35 miles, I was consumed with fear that someone in my family had passed away. When I reached the medical officer by telephone, my first questions were about my family. She reassured me that they were all fine, but informed me that I would need to travel to Ouagadougou, the capital city of Burkina Faso, where she and the rest of the coordination team were based. To reach Ouagadougou would require an additional 7 hours of driving time. I insisted that the Peace Corps medical officer tell me what was going on before I agreed to come. What I learned next was a great shock. About 2 months prior, to encourage a friend who had had unprotected sex to get tested, myself and several other Peace Corps volunteers had requested a voluntary HIV test at our mid-service medical exam. To my great relief, my friend's test had come back negative, but I learned that day that mine had come back positive. As I tested negative for HIV prior to joining the Peace Corps, and I was able to rule out a sexual exposure, this meant that I had been infected by HIV through blood during my service. My thoughts returned to the man whom I had helped on the side of the road almost a year earlier. And my naivety, my rush, and my concern for his well-being, I had not worn gloves when I treated the man. To be honest, incredibly, I had not even considered the potential exposure at the time. But in 2001, while antiretroviral drugs had been in use in the developed world since the late 1980s, greatly reducing the risk of secondary infection, in the developing world, only private clinics were providing antiretroviral medications, making them largely inaccessible to much of the population. The man I assisted likely had a very high viral load, a measure of the number of times that the HIV virus has replicated in the blood, and was therefore extremely infectious. Learning that I had HIV was upsetting, but what happened to me next was far worse. The Peace Corps automatically medically separated me, meaning that they discontinued my contract and sent me home to the United States within a matter of days, despite the fact that I had an HIV infection which was asymptomatic at the time and which ultimately, even without medication, would remain asymptomatic for nearly a decade. Back in Washington, D.C., I requested to return to my village. In response, I was told by Peace Corps that my service was over, that I had no chance of appeal, and that I should go home and be with my family. All I could think of was, what about my African family? To receive a diagnosis of HIV is hard, but to be ripped from your life, compelled to suddenly leave behind people you love, and told that you can no longer be of service to your country as a U.S. Peace Corps volunteer is devastating and discriminatory. Further compounding my sorrow was the additional loss that my village suffered. For when I left, all funding opportunities tied to me were also taken away. My village had already completed a significant amount of legwork for the construction of a maternity ward. It had all been for nothing. Living with HIV is not without its challenges, but the distress of being forced to abandon my village was then and remains to this day my most profound loss and greatest tragedy. While it may seem hard to understand, if I knew now that going into Burkina Faso would result in me acquiring HIV, I would still choose to go. The experience of being a Peace Corps volunteer was the single most defining moment of my life. It reshaped my worldview, introduced me to the warmth of African people, and showed me that human beings can face pain and suffering on a daily basis with courage and grace. What I saw in Burkina Faso inspired me to try to adopt the same outlook to my own pain and strengthen my commitment to the developing world and to public health. Trying to move on with my life, I came to the University of Michigan, where I obtained my master's in public health and epidemiology and began working at the Center for Social Epidemiology and Population Health. Eventually, I began coordinating clinical research for Dr. Allison Thyolo, a dedicated mentor, talented teacher, and generous friend who helped me to further develop my potential. While working for Dr. Thyolo, in a touching twist of fate, the friend whom I had encouraged to get an HIV test, notified me of a story in the Washington Post by Steve Barr. This was 7 years following my own HIV diagnosis. The story was about Jeremiah Johnson, a U.S. Peace Corps volunteer in the Ukraine who in 2008 had tested HIV positive during his mid-service medical exam. Like me, Jeremiah had been automatically medically separated, despite the fact that he also had an asymptomatic HIV infection. Back in the United States, Jeremiah had contacted the American Civil Liberties Union and gone public with his story. In the newspaper article, Peace Corps went on record stating that Jeremiah was the first volunteer to ever test positive who had wanted to return to his country of service. I knew that that was inaccurate, so I went online and using the Contact Us screen of the ACLU website, I sent an email with my own story. By the next day, Rebecca Shore, the ACLU attorney representing Jeremiah, had contacted me and asked if I too would speak out. With the full support of my remarkable family, I agreed, and soon my story also appeared in the Washington Post. Of note, for me and for Jeremiah, the decision to speak out publicly was not meant to slur the name of the Peace Corps, which is truly a wonderful and amazing organization. Rather, it was done to help the Peace Corps live up to their own ideals. With the help of U.S. Senator Chris Dodd, himself a returned Peace Corps volunteer and chair of the subcommittee which oversees the Peace Corps, the devastating experience, which Jeremiah and I both share, resulted in a change in U.S. Peace Corps policy. Now, U.S. Peace Corps volunteers who test positive during their service are no longer automatically medically separated, and HIV-infected candidates can apply to be volunteers. With the help of medication, my health continues to be excellent. And I have since realized my dream of returning to work in the developing world. For the past 2 years, I have been working with Doctors Without Borders, also known as Médecins Sans Frontières, or MSF for short. I am currently the operational research coordinator of an HIV/AIDS project in Thyolo, Malawi, where because of the collaboration between MSF and the Malawi Ministry of Health, over 17,000 people in Thyolo district alone now have access to life-saving antiretroviral medications. In closing, I would like to share the words that my compassionate pastor, Reverend Susan Sprouse, would announce at the end of every service at Lord of Light Lutheran Church, a small and loving faith community here in Ann Arbor. The words are, "Life is short. We have but little time to gladden the hearts and the minds of others. Go and serve the Lord." For me, one of the beautiful aspects of our world is that we all have our own belief systems. But one thing is universal. We all experience pain and suffering. Sometimes, in the process of overcoming our sadness and sense of injustice, of letting go of our pain and sharing our experience, we can transform our suffering into something which can gladden the hearts and the minds of others, something which can have an impact far more profound than we ever imagined, something which can change the world. Thank you.